Today I thought I'd record one of the exercise that I frequently give my clients. It's a stabilization exercise for our lower back. So a lot of us have lower back pain, and a lot of the times because we lose the ability to stabilize in our lower back through this muscle called your multifidus. So it's a little triangle shaped muscle that gives you the deepest stability closest to your spine, and you find it all the way from your tailbone all the way to your cranium, your neck really. So what we want to do is we want to focus on the multifidus muscles down in the lumbosacral area, which is most commonly what people have trouble with. And we know with lower back pain, through all the MRIs and CT scans of people that we see with chronic lower back pain, multifidus tend to be really small or atrophy in those people, and that's one of the reasons why people have constant back pain, because you don't have multifidus to stabilize it. So I'm going to teach you a exercise that you can start to relearn how to use the multifidus in the whole system. So you're going to have to be lying on your tummy. So we're going to start off with the basic, and then we want to work on progressing it naturally. So you want to come into a half prone lying position. So you want to be you want to have your hands on the ground, and you want to have your chest lifted up so we're not completely face down on the floor, and you want to be relatively relaxed in this position to start off with. Okay, so you're gonna have your palms flat down on the floor, and your elbow is also your stability point. So you're going to hold onto the floor or the mat with your two stability points, one on each side, and you want to make sure your chest is lifting away from the ground. So you don't want to sink into the ground, you want to lift away. So we've got nice open chest. You want your neck long, your chin tucked, so you have that nice straight line on your back. And you also want to make sure that you are tucking your tailbone a little bit so you're not sinking into your lower back. So we don't want to be lazy with our positioning, we want to actually be actively holding this position. Okay. So once you get into your starting position, long neck, chin tuck, okay, this is the easiest version of it. So this is the starting point. So you want to take a breath in, and when you breathe out, all you do is lift the palm off, but you still have your elbow as a stability point, okay, along with your other side. You want to be able to do this without your pelvis dropping down, okay? So what we commonly see is when people do that, they compensate by shifting down to our pelvis. This is not what we want, okay? So your multifidus is a rotational muscle as well. So we want to make sure that we're not actually sinking into it. We want to make sure you can keep your pelvis square. So when you lift up, you can keep nice and square and stable through your pelvis. Breathe out to lift off. Breathe in to roll back down. Same thing with the other side, okay? Breathe out to lift up, and making sure we're not dipping through the other side as well. Making sure your neck long, chin's tucked. Now, some of you will find this really difficult, but some of you will find it super easy. Okay, so if you find it super easy, it means you can do the next step. Same position, long neck, chin tuck. You want to take a breath in. When you breathe out, you're going to slide your hands off to straighten the elbow as far as you can go without your pelvis sinking. Okay, and once you get up there, you breathe in. And when you breathe out, you want to dig through your armpit. You want to pull your elbow back in without dropping through that pelvis at the same side. Okay, so you're actually thinking about like pulling back with your shoulder blade to do that. Same thing with the other side. Breathe out, straighten. Breathe in, pull back. And this one again, just to show you one more time. Chin tuck, neck long, lengthen, pull back without dropping.